Welcome back. We're joined now by Chelsea Phillipe from Rendorf Pediatric Therapy in Bismarck.
And today we're talking about speech intelligibility.
Intelligibility.
Tell us about
what it is. Yeah.
Yeah, so speech intelligibility is basically a rating that we use to determine what percentage of a child or anybody in that matter, what percentage you can understand of their speech. So when they're saying something, how much of it does the listener understand?
Okay, now for me having a baby that is not yet speaking, I'm familiar with this only because maybe you go and meet other families and you hear some baby talk, and not being familiar with the child, you might not be picking up on what they're saying. So that's what you're measuring with intelligibility.
Correct.
Okay.
Yeah, and intelligibility doesn't really come into play until a little bit later on, till when they're starting to use real words. That jargon and that babble is important early on, but then once they start to use real words, more closer to 18 months and past that is where we would start to measure the intelligibility.
Excellent. And tell us about how you are measuring that. What are you looking for?
Yeah, absolutely. So basically what you're measuring when you do measure the intelligibility is, are you understanding the word that the child is saying? Are you understanding the phrase that the child is saying? And there are some, developmental guidelines that help us determine is the child where they should be for their age, can you understand as much as you should be for where they're at?
So is there a scale for that? How do we judge that?
Yeah, absolutely. And the norms with them are kind of flexible, but I do have a chart available that we can share too. But what we kind of look at is, we look at the intelligibility based on, is it being measured by a familiar listener or an unfamiliar listener. Familiar would be your typical caregivers that are with the child on a consistent basis, a daycare provider, a parent, a grandparent. Unfamiliar listener is going to be somebody that doesn't have consistent contact with the child, the clerk at the grocery store or a extended family member. Some norms that we're looking for: by 18 months, we want an unfamiliar listener to be able to understand approximately 25% of what a child is saying, while the parent or the caregiver that's with them more consistently should be understanding closer to 50% of what they're saying. As they go on to 2 years old, then an unfamiliar listener should be understanding about half of what a child is saying, while it increases then for the familiar caregiver to be closer to 75%. As they go through that third year of life, we want the unfamiliar listener to understand 75% of what they're saying, and then the familiar caregiver should be nearing 100%. Then as a child gets to 4 years old and nearing that through the fourth year of life, they should be close to 100% intelligible to all listeners, regardless of the setting or where they're at.
Now, what if my child's a little behind in these percentages? What are things you guys can do for that?
Yeah, absolutely. One of the reasons we do the intelligibility rating is because it kind of tells us, are there speech sound errors? Is there too many speech sound errors that it is affecting their ability to be understood? And that's where we would come in. If the intelligibility is low, we would then probably do a speech sound assessment and try and figure out, what's happening with the speech that's causing the child to be misunderstood.
Now, what would be included in a speech sound assessment? For someone who doesn't have a kid, this is all new to me.
Yeah, absolutely. Well, there are a few different types of errors that kids can be making, and that's one of the things with intelligibility and one of the things that comes to us a lot is a parent will call and say, my child's talking, but I don't know what they're saying. So that's up to the speech therapist then to determine what are the sound errors. Are they cutting sounds out of a word and saying, they might be saying top for stop, or they might be saying ma for mom and cutting sounds out of parts of the word, or they might be substituting sounds, saying tat for cat or wabbit for rabbit. So we would look then at that to determine what are the sound errors that's affecting their intelligibility.
Intervening then and helping that child with their speech is then going to help them progress in so many other ways, especially as they're getting to an age where they're going into school, right?
Yes, absolutely. Yeah. And that's one of the reasons we do, the intelligibility measure at a young age, is that going into school, we do want a child to be understood going into kindergarten, that they can clearly communicate their thoughts and feelings and wants and needs, so that they're not held back in that manner.
Right, getting their education off on the right start. Is there a reason why us as parents can sometimes understand a lot more, get what our child is saying versus young people?
Yeah, absolutely. So as children are developing, they will simplify language. You know, between birth and 5 years old, a child has a lot to learn, starting from nothing to being able to be a fully functioning, you know, communication partner. So in that process, they will simplify language. So that's one of the things that it might even be, one of their speech errors might be a pattern that somebody might not be able to pick up on, or be able to say, you know, my child's always cutting this sound out or this, but you pick up on that pattern and you can figure that out without really realizing that you figured it out. So.
Now, if people want to learn more, where can they find you guys?
Yeah, we have clinics both in Bismarck and Minot, so you can contact us at either of those. We do have central scheduling, so you can contact us at 222-3175, or you can check us out on our website.
All right, thank you for joining us.
All right, thank you.
We'll be back with more North Dakota Today right after this.